Hi guys, Dr. Selene here with BU Medical. I know you guys have probably heard of Botox. It's kind of a really common name. There's a lot of misconceptions about Botox, and I'm going to go through 5 of them with you now. The first misconception is that Botox is too expensive. A lot of that price point depends on where you live and how many units you're getting. So Botox is often charged per unit. So that's a discussion that you want to have with your provider about how many units do you actually need. And that will help you make it so it's something that's affordable for you, because it doesn't have to be over the top. And sometimes some people will give you a little bit higher dose so it can last longer. So these are good discussions to have with your injector to determine what is the best course of action for you. The second misconception is that it hurts, and I will say that me being a little bit of a wimp, it does hurt a little bit. We use the tiniest syringes in our clinic, and many clinics use like an insulin syringe just like we do. So you want to make sure that it's something that they have things that can help you with pain control. Some people use ice, some people use a little vibrating pen, and again, it's a small needle. It feels like a pinch or like plucking an eyebrow, so it's doable even for a wimp like me. Another thing that comes up is that it's a toxin, which is really confusing and because it sounds toxic, but this is not a poisonous thing for your body. Remember that in medical care, we use Botox in thousands of unit dosing. In aesthetics, we primarily use it in less than 60 to 80 units. So it's very, very tolerable. It's derived from a bacterial component and it's created into a protein. So it's actually a protein that's going into your skin and it's not toxic for you. Another misconception that you may have heard of is that you'll look unnatural. And there certainly are some times where I've over Botoxed myself where I'm like, well, I did it a little too far. But remember, if you're using good discretion with you and your provider, thinking about the units, you can still have movement. And it's something that we strive for in our clinic is a more natural look, and something that you should discuss with your provider if you are shooting for a more natural look. That may mean less doses with more frequent visits, but it's a goal that you want to determine in your head and make an agreement with your provider ahead of time. The last misconception is that there's a lot of downtime with this, and there really is no downtime. So you can literally come in on your lunch break, you might walk out with little bumps, but those will be gone by the time you get back to work. You can end up with a little bruise that's usually easily covered with makeup, so it's a no downtime beautifying procedure. Now you have all the information to book your appointment, so there's a few things that I want you to do ahead of time. I want you to avoid things like aspirin, ibuprofen, any blood thinning medications, as well as some over-the-counter medications or supplements like fish oils, ginkgo, alcohol. The reason being is that they can also thin the blood and can cause bruising. After you've had your treatment, there's a few things that I want you to know. One is that I want you to relax. I actually want you to be a couch potato. I don't want you doing a bunch of yoga afterwards and bending down. I don't want you going out for a massage or getting a facial or a laser treatment for about 2 weeks. Now, the medication probably does get absorbed much sooner than that, but we don't want to risk the chance of the Botox moving and inadvertently hitting a different muscle that it wasn't intended to treat.